One major tips that I'm going to be giving you is when you are going for the interview, please wear your boldness. I don't know where you want to say it, but be bold. Just be in their presence and be stammering. They don't want to hire somebody that is scared. That's one of the reasons why a lot of people don't get hired too. Because once they notice it that you are scared, it's a no for them. So when you are going, please wear your confidence, wear your boldness, be assertive enough, and I promise you, like, even if you don't get it, at the end of the day you'll be happy with yourself that you are not scared of anybody, and yeah, you did well. Hi everyone, how are you doing? You're welcome to my YouTube channel. If this is the first time you are coming across my video, my name is Elizabeth Odoayo. I am a registered nurse, registered midwife, and registered public health nurse. Today I am going to be talking about the questions you should expect from your nursing internship test and interview. By the grace of God, I've attended few interviews and I've put down the questions that were asked from those hospitals, and I'm going to be sharing them with you. I know I did a video recently where I talk about internship now in Nigeria is about connection and all, but there's a need for you to have something in your head in case they want to pick based on that. Or if somebody wants to help you, they might require that they see your test or exam results before they can offer any help to you. For some hospitals, your exam is going to be written exam and some is going to be CBT. So the first question I'm going to be talking about is, who is a nurse? And please, if you are giving them definition of who a nurse is, try to put it that a nurse is a licensed healthcare professional, because that is exactly what they are looking for. They want to know that you have the understanding of who exactly a nurse is. The second question that is like it is, what is nursing? When you are giving them what nursing is, you have to define it according to someone. So like, what is nursing according to Mother of Nursing, which is Florence Nightingale, or what is nursing according to Virginia Argentin? Some interview they are going to ask you that you should define based on someone, and some they will not ask you, they will just ask you they should define nursing. And please just try to make sure that when you are giving them, you are defining it according to someone. And another one that is like it is, they tend to ask for field in nursing. Like, they can be like a nurse that is taking care of old people is who, so they will put options there. Geriatric nursing. They can ask that a nurse that is taking care of babies is what. A nurse that is taking care of people that are mentally unstable is. So you just pick. Most time those ones comes in CBT. The another question that they normally ask is triage questions. They will give you case scenario. They want to test your competency and your practical skills. They might just put that a patient that presents with head injury and a patient that have fracture, a patient that is presenting with body pain, which one are you going to attend to first? So just like triage questions, they ask that one a lot. Then drug calculations. For few exams that I did, they ask drug calculations. You cannot but say it. For example, they might be like, Promate comes in 50 milligram in 2 ml. So they will just be like, if you are giving a patient 12.5 milligram, how many meals are you going to be giving to that patient? You just need to calculate. Some of them will not give you calculator to calculate it. You just have to calculate it using your head, and yeah, and you have to be fast because the time given might not be enough for everything. So another one is procedure in nursing. They tend to ask you procedure in nursing. They want to be sure that you know a lot of procedure. Some can ask you to list the procedure in nursing that you know, and some might just ask you one procedure that you should explain it to them. The one I was asked, I think it was oxygen administration. Current affairs, yes. I was asked about Olympic where they play Olympic this year and the activities that made it fun. That was what I was asking. Current affairs. They asked who was the first female to drive a car, the first prime minister in Nigeria, the name of the 10th assembly speaker. So they asked that one too. So current affairs, especially about the hospitals that you are going for. Who is the CMD? Who is this person? Who is this person? You can just try to read it up and get familiar with the hospital. Patient Bill of Rights. So they asked me that one too. Then interview. Some of the questions I mentioned for the exam too, you are going to be asked for the interview. But let's go into interview proper. There are some questions that they cannot but ask you for interview. There's no how you want to do it. They will ask you to introduce yourself. And I will advise that you do practice about this before you go for the interview. Because in next minute, you can turn to a stammerer that you don't even know who you are again. They will give you enough time to introduce who you are. Try to tell them things that you do, your qualities, and maybe part of your experience. Tell them, introduce yourself to them based on what you are there for, which is getting the role. Just do some practice before you go. And again, some will ask you their interview questions from your CV. Please, whatever you don't know, don't put it there that you know it. Whatever skills, whatever things that you know you cannot do, don't put it in your CV that you can do it. Reason being that you might be asked these things. They might ask you, you can do this, how will you do it? For me, they checked for my CV and they asked me, yeah, you say you can do wound dressing. I said yes, and they were like, okay, tell us what wound debridement means. And I was just looking like this. To be honest, after checking it and know what it is, it's something that I know. But at that particular time, it wasn't coming to my head. What I'm trying to tell you is that they don't expect you to know everything. In case you forget something or you can't remember, just make it known to them instead of you to say nonsense and be like, is this something that you know that you don't know? So instead of you telling them what you don't know, it is better you tell them that, please ma, I don't know it, and don't put yourself under unnecessary pressure. Yeah. So, and another one like it is, they will ask you this one. Most hospitals will ask you this one. Why do you think we should give you this role? Why do you want to work with us? Why this hospital? And you just have to tell them. And one important point you need to make is you do a research about them before applying, and things that you know they do and their qualities as a hospital. Just try to mention it to them. This might get you the role. And yeah, fundamental of nursing. Believe me sincerely, just to read your fundamental of nursing. They are, especially for the exam questions, fundamental of nursing is what they usually ask. It's not something that you don't know. It is something that you'll be able to answer and answer well. So these are just the few questions I was able to gather from the interview and the tests that I have done. And I hope this give you a clue of what to expect from your nursing internship exam and interview. If you are yet to subscribe to my channel, please try to subscribe and expect more videos from me. Thank you.